Come in.
Alright, hi, my name is Lauren Stewart. I'm a nursing student at the University of South Alabama, and I'll be doing your cardiac assessment today. Is that okay with you?
Yes, ma'am.
Alright, so first I'll need you to remove your shoes and your shirt, which you've already done. So now, perform hand hygiene. I'll be looking across the pericardium to see in case I can see any kind of the visual of the avical impulse, and I see it. And I'm also going to check for any kind of lesions, abrasions, or anything on your chest area, and I see a few scars, but nothing that is cause of concern. Alright, so we see that the avical impulse is seen at the fourth or fifth intercostal space, move flacular line to the left side of the sternum, and we've looked for heaves and lifts. So now I'm going to state that the normal beats per minute for your heart rate is 60 to 100. So, and that is regular and not irregular. So I'm also going to state that the base of the heart is at the second intercostal space on the right-left sternum, and the apex of the heart is at the fifth intercostal space, mid-clavicular line on the left side of the heart. So I'm going to palpate with one finger at the apical impulse at the fourth or fifth intercostal space. And I'm going to have you breathe, exhale, and hold, okay? Alright, I feel it. So now I'm going to move on to oscillating your valve sounds. So my locations are the aortic valve located at the second intercostal space to the right of the sternobordal. The pulmonic valve is at the second intercostal space at the left of the sternobordal, and the tricuspid valve is at the fourth intercostal space to the left of the sternobordal, and the mitral valve is at the fourth to the fifth intercostal space to the right of the sternobordal. So I'm going to go about palpating with my bell of my stethoscope and listening to your heart rates, okay? Alright, these all sound normal. I heard no extra sounds or murmurs. The S1 is the love, which is the start of asystole, and is heard at the apex of the heart. And S2 is the dove, which is disystole, and is heard at the base of the heart. So the S1 is the closure of the AV valves, and the S2 is the closure of the simulator valves, which is the pulmonic and the aortic valves. So now I'm going to check your pulse deficient. So I'm going to take my bell at the apical impulse, and you're going to turn the head to the left, and I'm going to palpate your carotid artery. So turn your head that way. Alright, very good. So it seems like it's exactly equal. So now I'm going to listen to your carotid breweries. So I'm going to have you turn your head, take a breath, exhale, and hold. Okay? Alright, turn your head this way. Take a breath and hold. Alright, very good. So there were no breweries noted. So now I'm going to palpate your pulses. So I'm going to do your carotid first. Now turn your head this way. Now I'm going to test your brachial. Alright, your radial. Alright, so now I would be doing the femoral, but it's found in the groin area. So, not going to do that. And now I'm going to check your dorsal pumps on your feet. Okay, so I'm going to move my camera down so you can see me do it. Alright. Alright, so now I'm going to move your thing up so I can look for any kind of edema or anything like that. Alright, this looks good. Alright, so now I'm going to check your, I checked your shins for edema and there was none noticeable, so now I'm going to check for perfusion in hands and fingers, okay? Alright, so your fingers look to be convex and pink. Your capillary refill is normal, it's less than 3 seconds. Alright, and can you make a diamond for me like this? Like this. Alright, so we see that the diamond's present and there is no clubbing present and that your fingernails are less of 160 degrees, okay? So, and all your pulses were 2+ and equal lateral. So we're checking over your assessment. You look like you're in good shape. So thank you so much.